The coverage that has to be covered, at least to a certain extent, under Medicaid is inpatient and outpatient hospital services, nursing facility or home health services. Now, some of these may be paid on a limited basis, but there has to be some coverage. The EPSDT services, that's early and periodic screening, diagnostic, and treatment services. Physician services, um, rural health clinic services, and there are some of those in this particular area. Um, Laboratory and imaging, x-rays, things like MRIs, CTs, and so forth. Family planning services, that may be contraceptive management or those kind of things. Um, Nurse midwife services are covered under this too, as a extended provider. Transportation to medical care. If this person has no money or little money and they need services that are required outside of that particular area, then they have the ability to have some um, expenses for medical transportation. And then smoking cessation counseling, especially to pregnant women. That's the target here. Medicaid eligibility is determined by the state that person happens to live in. Most of them are low income persons. They may also be a pregnant patient and child who qualifies under the rules. Uh, There may be persons who are included under temporary assistance for needy families. So this is a short-term thing typically on this case. Um, Persons who receive supplemental security income, that's a part of the Social Security coverage. So they may have Social Security that is a very low amount, so that makes them qualify for additional money under supplemental Social Security that falls under Medicaid. Persons who receive certain types of medical and state aid, persons who are qualified Medicare beneficiaries, and persons or institutions who are in long-term care situations. And again, some of these may be limited over certain times. Some persons under Medicaid and uh, Medicare can choose to join a managed care plan, which is more like a regular insurance. And if they have that, their insurance card will look different than it would with Medicaid and Medicare. Um, They may also have a co-payment and a payment they have to make up front for each per visit, which they are responsible for. So this is just another option under these two coverages. The CHIPS, or Children's Health Insurance Program, is another state program, and this may be for children who the family doesn't qualify because of income for Medicaid, but the children will qualify for services under the CHIPS program. It's similar to a managed care plan, which is a more regular insurance uh, that's covered through a particular network of providers. Under the program, it will include routine checkups and doctor's visits, immunizations and prescriptions, dental and vision care, inpatient and outpatient hospital care, uh, lab tests, x-rays, and emergency services. So there's a lot of things covered under this plan, but it's exclusively for children. TRICARE is the other federal-based insurance. It is a comprehensive or kind of all-inclusive healthcare program for persons in the military service and for people who've retired from service and for their families. Uh, it is managed by the military uh, with a partnership with an agreement with civilian hospitals and clinics. There are also a lot of the military bases will also have medical services provided specifically through those areas as well. There's two types of plans: the TRICARE Prime and TRICARE Select. The TRICARE is designed to expand access to healthcare. Prior to this time, or You have people who were in the military who may have their home location normally would have been in one state. Their military service was being provided with them living temporarily in another state. So with when the military is covering, they typically cover in the area that they are in. Now, if they went home and got sick, they would cover them in that area too. But it gives them wide, broad healthcare coverage, and it ensures them to have high quality care. So it's supposed to be as good a care as anywhere else. Um, and it also promotes medical readiness. It also means that they're going to try to keep them well, keep them healthy. So, for instance, if they get called up and sent out to maybe to with short notice to somewhere else, they are medically ready to go. So this is another big part of what they provide. CHAMP VA, or Civilian Health and Medical Program for the Veterans Administration, is another part of military-based insurance. Um, it provides coverage similar to TRICARE for families of veterans where the veteran was permanently disabled or killed in the line of duty. Um, the Department of Veterans Affairs shares the costs with healthcare services um, with eligible beneficiaries. So this is covering a different group, but it's still military connected. Looking at what we would consider more usual health insurance coverages, these health plans are available from a lot of commercial insurance companies. If you were a private person who wanted to buy insurance, um, there's also some that's covered under employer base and those kind of things. There's three types of plans. There's the employer group plan, which means when you go to work for someone and they give you the option of insurance, but they also, if they have a certain number of employees, they are required to give you some level of insurance. Now, that insurance can vary very widely from one employer to another. Coverage can be very good in one and be poor in another and still meet the qualification of providing insurance. Um, Another category, and this is used very broadly, is self-funded group health plans. Even employer group plans can be self-funded. Um, and these are ones that they maintain the cost of the insurance within that group. And when I say group, it's for anybody who has insurance under that particular plan. Employer-based group plans are a lot this way too, and it comes down to who makes the rules and who makes sure of the amount of money to pay cost. And then there's individual health insurance plans, the one that someone would go and get on their own. Um, in self-funded group plans, there's usually a third-party administrator that takes care of the paperwork and takes care of ensuring the payments for the plan. And then in individual health insurance is usually not offered in the workplace or by another group. These are ones that you go directly to an insurance company exchange of some kind and purchase it independently. Participating provider contracts are another part of insurance. With all of the government health plans, most of the private providers have to be a participating provider. PAR is abbreviation here. And a participating provider um, agrees to accept the insurance plan's fee schedule, even if it's lower than what they would normally charge in their own fee schedule. This is with an actual agreement to that effect up front. Providers can apply to become a participating provider through what's called credentialing. Uh, and in credentialing, they're just going to confirm that the provider meets the right level of qualifications. Once the insurance provider is credentialed, then the insurance plan issues a contract with an in network participating provider. In other words, Network is a group of providers that have agreed to the circumstances, conditions of the particular insurance, and they've signed a contract to that effect. In setting up a contracted fee schedule, usually the provider is going to create a schedule that includes the consideration for things like how much time it's going to cost them to see particular patients, um, how much expertise, knowledge, skill, and those kind of things that has to be included in it. And what services are they going to provide? So those are three parts that are considered. Um, and then they have to place an estimate on the value of the services that they will provide in their office. Um, Allowable charge is the maximum amount the insurance is going to pay for a particular procedure or service. And service may be an office visit, procedure may be, let's say, a minor surgery of a certain type. So there are limitations in how much they will cover on that. Payment for services is usually made after the services, of course, are provided.